Hello and welcome once again to Health Talk with Miss Irene. Thanks for watching my videos. I know I haven't posted a video in a while. I was managing my right shoulder injury, but I'm back. We're going to talk about managing our diabetic foot ulcer. If this is your first time or you have not subscribed to my channels, please do so and you're going to get the videos once I post them. So today we're going to talk about healable diabetic foot ulcers. We have the healable, we have the maintenance, and we have the non-healable. We'll talk about the maintenance and the non-healable in subsequent videos, but today we're going to discuss healable diabetic foot ulcers. So if you have a diabetic foot ulcer, you should see a 20 to 40% decrease in wound size by week 4 to be able to know that this wound is going to heal by week 12. If you do not see a decrease in the wound size or it's increasing by week 4, you've not seen any 20 to 40% decrease in wound size, there is a high chance that the wound is not going to heal by week 12. Okay, and to classify your wound as healable, first of all, you should have good peripheral arterial circulation. That is, we get good oxygenated blood through your legs getting into the wound on your foot. That is very important to help with the wound healing. So when you have that, then we can comfortably say that this wound can heal. Without that, it's very difficult for your wound to heal. So I'm going to show images. These are images I got online showing how a wound progressed to the healing stage. So if you see that you have a wound that looks like that, then it gives you an idea about what stage your wound is, what should be done, and then you also comply with your clinicians. Then you understand what is going on and why they're telling you that. So when you look at the first wound, you see that it's covered in 100% eschar. It's a heel wound. It's covered in 100% eschar, which we call the dead tissue. Usually when we see our wounds dry and scab like this, we think the wound is healing. So if you happen to be managing your wound at home and you see that your wound is all scabbed like this, looking like this, don't mistake it as healing. No, it's not healing. Usually these wounds get bacteria underneath it and they go into the deep tissue and cause infection. So go right away to the hospital if you see your wound like that. When you go in there, they do what we call debridement. So they'll have to debride that black surface of the black scar, so dead tissue that needs to come off for us to see the wound bed and treat it. Okay, so they get that off through either surgical sharp debridement if you have good arterial circulation. This is done by a surgeon in the OR. They scrape all that black stuff off and then we get the wound bed clean up. You can also do it by consecutive sharp debridement at the clinic by a wound care specialist, or we can do autolytic debridement with wound dressing that makes the wound bed moist and eventually breaks it down. But that takes a while, but the sharp debridement is quick and get it off as quickly as possible. When you look at the next image, you can see that all the black eschar is gone, but you can see that there is a slough on the wound. That slough is a firm slough, and so that needs to be debrided as well. So debridement is not done just once, it's done regularly throughout the wound healing journey. So this needs to be debrided. It is all firm, it needs to moisten up and getting off. So this can be done by all the means that I talk about. The debridement means it can be done by that. Looking at the next image, you can see that there is still some kind of slough on there, but it looks like it's moist, right? It's a soft slough that can easily come off. And you can also see some red areas on there. So these red areas are granulation tissues, which we like to see there. So it's a good sign that we see there, but still it needs to be debrided. So at this point, you can see that there is some kind of peri-wound maceration. So that is what we see, the white areas around the wound. If you have a wound and you see all those white areas and it is getting bigger, that shows that there is too much exudate or too much drainage in your wound. So then you need a dressing that will absorb that drainage. You need a high absorbent dressing that will take the drainage off the wound bed. And you also need a dressing that pulls out the drainage of the wound bed but stays in the dressing and not on top of the wound bed. Some dressings will just collect the drainage and it sits on the wound bed. You don't want that. You want a dressing that will take it and absorb into the dressing, and then keep the wound bed, have a good moisture balance on the wound bed. Okay, so that is what you need. And then you prevent all the maceration, because over time when the maceration gets bigger with high drainage, it can break up into wounds as well, and then get your wound bed bigger, which you do not want. When you look at the next wound, you can see that we see a lot of red patches, which we want to see. There has been good debridement there, whether it was done by any other means. Still, it looks good. We see more granulation tissue on there. And when you look at the next image, you can see that the peri-wound maceration was dealt with very well, and you can see that the wound bed is 100% granulation tissue, which we want. It is all red, and we are happy when we see this. We see that the wound is healing. So when you look at the next image, you see that the wound is all healed. So this wound has transitioned very well. It's healed in week 14, and it looks very good. So throughout your wound healing journey, you want to make sure that you are in control of any sign of infection. You are up to it. You want to look at my other videos for signs of infection. If you see peri-wound redness around the wound, you see that it's warm to touch. If you have pain, if you do not have neuropathy and you have pain, that is a sign of infection. And so that and increased drainage, you want to go to the hospital and get it checked. Usually they can give you oral antibiotics to help it. Otherwise, the infection can stall the wound and prevent it from healing. Sometimes it's just inflammation that also stalls the wound. Okay, so then your clinician will take care of that. And very important for you to offload. If you have a wound like this, if you have a wound under your foot, please do not walk on the foot. Okay, you have to offload. Usually either they tell you to use a clutches, do not walk on the foot. Please adhere to that. Okay, if you've given an offloading boot, please put it on. Wear it every time you walk. Do not walk without those offloading boots. Very important to get the pressure off your foot. Okay, that will help you heal your wound. So first of all, you make sure you're on top of your infection. You make sure that you are also offloading and also sticking to your wound dressing protocol. If you are asked to come in for dressing change, please go. Usually when we see that the wound bed is colonized with bacteria, sometimes it's just on the surface of the wound. We use some kind of povidone iodine. Usually that's what we use for highly infected diabetic foot ulcers. We use that for a bit, and then when we see that the infection is all cleaned up, we want to transition to another dressing where you do not have to come frequently. Usually when you have povidone iodine on there and you have increased drainage, the dressing change is daily. You want to do that daily. If it's hard for you to go to the clinic, usually your clinicians can teach you, but make sure that you wash your hands, you do the right thing to do it at home if you can. Otherwise, please go to the hospital every day if it's a daily dressing with povidone. When the wound progresses well, usually they will transition you to maybe an antimicrobial agent, like maybe the silver alginate, which is also good in getting bacteria off the wound bed. They can transition you into any of that you do not have to come in for daily dressing. And also if your drainage has come down, they might transition you into maybe every 2 or 3 days dressing change, which will be good for you. So very important for you to adhere to that as well. Okay, I'll also go through some of the wound dressings that on the market. It usually will be a wound dressing that I'm familiar with, but I will show you what these dressings does, when you can use them, because usually the wound healing journey, you don't use one dressing throughout, right? They change as it goes. Okay, so we'll walk through that as well. I hope this video helps. You've learned something from it. Let's prevent it if we can, but if we are not able to prevent it and we get it, let's manage it well so it heals and do not transition into maintenance or non-healing. Okay, so you take care and you stay blessed. Bye for now.